Multiple perspectives on symptom interpretation in primary care research. So, this is a journal article from BMC Family Practice by Rosendale and others. Here we see an abstract which is divided into three components. Let's read it out and we will try to understand what it means. Background: assessment and management of symptoms is a main task in primary care. Symptoms may be defined as any subjective evidence of a health problem as perceived by the patient. In other words, symptoms do not appear as such. Symptoms are rather the result of an interpretation process. We aim to discuss different perspectives on symptom interpretation as presented in the disciplines of biomedicine, psychology, anthropology, and the possible implications for our understanding of research on symptoms in relation to prevalence and diagnosis in the general population and in primary care. In discussion part, we see symptom experiences are embedded in a complex interplay between biological, psychological, and cultural factors. From a biomedical perspective, symptoms are seen as possible indicators of disease and are characterized by parameters related to seriousness. For example, appearance, severity, impact, and temporal aspects. However, such symptom characteristics are rarely unambiguous, but merely indicate disease probability. In addition, the general practitioner's interpretation of presenting symptoms will also be influenced by other factors. From a psychological perspective, factors affecting interpretation are in focus. For example, internal frame of reference, attention to sensations, illness perception, and susceptibility to suggestion. These individual factors cannot stand alone either, but are influenced by the surroundings. Anthropological research suggests that personal experiences and culture form a continuous feedback relationship which influence when and how sensations are understood as symptoms of disease and acted upon. So, in summary, we see the different approaches to symptom interpretation imply that we need to be cautious and conscious when interpreting survey findings that are based on symptom prevalence in the general population or in primary care. These findings will reflect a variety of interpretations of sensations which are not equivalent to expressions of underlying disease. Furthermore, if diagnosis of disease is based exclusively on the presence of specific symptom characteristics, we may risk reinforcing a dualistic approach, including medicalization of normal phenomena and devaluating of medically unexplained symptoms. Future research in primary care could gain from exploring symptoms as a generic phenomenon and raised awareness of symptom complexity. So, from this little bit of abstract, which consisted of background, discussion, summary, we can say that we we cannot actually determine disease from symptoms only. When we visit a doctor with some symptoms, for example, headache or maybe mm, acidity, you are most likely mm, experiencing something which is very normal, and it may not be normal thing, but mm, the problematic part here is that sometimes we presuppose a disease by extrapolating on the symptoms that we have. Sometimes this becomes really problematic when we actually extend the symptoms to stretch the symptoms in a way then that it becomes very extremely um, dangerous disease. For example, you may have a rash in your skin and you have had some experiences with burning sensations and other feelings, and all on a sudden you are figuring out that you have cancer or some sort of STDs. So then you go to a doctor, and the doctor can also influence you back. Like he can induce you to feel that you might have some sort of unexplained disease, and he will be asking you to go to a diagnostic center and get yourself tested for many other diseases. So the smartest thing to do here is, if you have some sort of symptoms and if they are bearable, you should just meditate and do not consider those symptoms as anything serious. So here the problem again arises because of the issue of seriousness. Sometimes when we are sick or we have some sort of symptoms, we tend to think that we tend to compare our symptoms with others around us. For example, if you are a woman in her 30s, you might be having difficulty going while going to the toilet, when you are urinating. So, and you are maybe have some issues with your menstruating cycle, and sometimes there may be issues with your stomach ache, backache, shoulder aches. So since you are a woman in her 30s and other women are telling you that these are very normal phenomenon and you shouldn't be worried about this, you might end up not going to a doctor and developing a serious illness. And on the other hand, if you are a man in his 30s and you have developed the same symptoms, and since other men are complaining or telling you that these are not normal, then you might become really anxious and end up visiting a doctor who might tell you stuff which will make you take decisions that are not actually mm, considerable. Anyways, so there are three factors that can uh, affect the decision making or interpretation process. For example, first one is biomedical. That is, you might actually feel something in your body. You might feel a certain itch in your back, certain pain, sharp pain in your heart, or maybe the sternum area, or maybe you might notice infrequent bowel movements and many other sensations and feelings. And maybe there are some physical evidence as well, like there might be some swelling, sweating, itching, and maybe other physical symptoms that can be observable. So uh, it can also be psychological. For example, you might um, you might be anxious of something. You might be actually you might be actually compiling some theories in your mind. For example, uh, there is some muscle tension, and you are associating this muscle tension with some other disease because you have some knowledge about muscle tension and disease. And things like that can actually lead you to think that you have a disease. Anyways, and sometimes when you are old or maybe older, for example, you might be able to notice some changes in your body, and if you are not able to accept this kind of changes, you might end up translating them as diseases. Then there are cultural factors as well. I have already discussed how women can end up not complaining about their disease, and men can actually complain about a disease they do not have. So these are cultural issues. Anyways, these are the three things that Rosendell and her team actually explained in a really nice way. Anyone can actually consult this article, which is freely available online. I guess anyone can learn something out of it. My takeaway from this interpretation is that I am a person who is always looking out for symptoms interpretation online. For example, if I do not go to toilet or go to toilet too much, I will always look for some sort of interpretation online, and I will always end up, finding out something which is really unsavory. I cannot actually tolerate those kind of information. So, anyways, this is always a good idea not to um, look for materials on which you are not a professional, um on which you do not have any professional authority. For example, I'm not a doctor, or I am not a medical student, and so it would be very misleading for me to actually go on and look for information about a possible disease.